health and well-being, and we wanted to continue the conversation with this session. So I'll just wait just a little while longer just to make sure that we've got no one else kind of in the waiting room waiting to join us. And just in terms of housekeeping, we are going to record this session, so hopefully that's okay with everybody in our virtual room today. But if not, please flag up and drop either myself or Wendy a message in the chat box. And while I mention the chat box, please do keep your comments and questions coming in on the chat box, and we'll keep an eye on that as we move through the session and flag up any questions you've got for our contributors today. But also, we're a fairly smallish group, so if anybody wants to unmute and ask your question, put your hand up, then please do. We'd like it to be as interactive as possible for this session, so please do contribute as much as you can. Okay, right, great. Well, I think we'll make a start in that case, and really pleased to welcome 3 contributors for this session, and we kind of continue the kind of reach across borders with one of our contributors today, who's Colin Nealons, and he's from the Forum for Adult Learning in Northern Ireland, and we'll hear from Colin shortly. And then alongside Colin, we've got Helen Morgan, who is a change maker, fabulous title, from the Office of the Future Generations Commissioner. And also great to be joined by an old friend of mine by now, actually, by Glyn Roberts, who's from Well North Wales, a great initiative happening through Betsy Cadwallader Health Board up in North Wales. So we'll kick off with Colin. Colin, I know you're going to share some slides, so really interested to hear what you've got to say to us about developments in Northern Ireland and the reports and kind of advocacy work that you're doing there around adult learning and health. I'll hand over to you, Colin.
Okay. I've just got some slides which will hopefully magically appear. You always wonder about technology as you do this, don't you? There we go. Hopefully you can see that. Okay, well, I'm primarily going to talk about a report which we're going to be launching in 2 days' time, which is called Learn Well, Live Well, Adult Learning and Health and Wellbeing. Click on. Just to give you then some background to the report, this actually emerges out of the UK EAL, European Agenda for Adult Learning Programme 2020, and EAL in UK has been managed by the Learning and Work Institute, and the partners are Scotland's Learning Partnership and ourselves, FALNI, the Forum for Adult Learning in Northern Ireland. And there have been 4 impact forums set up by this initiative across the UK, and these were set up back in 2014. So they've been going for some time now, and the impact forums really bring together stakeholders from across all the different sectors to look at issues of common concern, issues that we might wish to advocate on, etc. And we found the links across the UK have been really, really useful for us. We're a very small part of the UK, a dot in the ocean kind of thing. And we don't have a sort of permanent setup in terms of being a forum as well. I do this on a freelance basis. The report I'm going to be talking about today really emerges out of an earlier report that all 4 impact forums contributed to, which came out in 2017, and which some of you might be aware of as well, which was the Healthy, Wealthy and Wise report, the impact of adult learning across the UK, which looked at how adult learning impacted on various different parts of our lives, including health. And so when we came to 2020, this was one of the themes that we wished to pick up on and develop further. And that was the contract that was given to us here in Northern Ireland. And in doing so, we had a very obvious partner locally as well, which is the Belfast Learning City. Belfast joined the UNESCO Global Network of Learning Cities in 2018. And it joined with a primary focus on using learning to address health inequalities. There are actually 5 UNESCO learning cities now in Ireland. There's Belfast, Dublin, Cork, Derry, Strabane and Limerick. So Ireland has really embraced the Learning City programme. So what's in the report once you get it? And as I said, we're launching it on Wednesday, and it will become available on our website late Wednesday. So we took we want to take quite a range of perspectives on health and well-being, and we wanted to engage both academic approaches to this and also practitioner approaches. So there's a fair range within the contents within the articles which have been written for us, which look at, as you see, health literacy, older people, mental health well-being, workplace, physical health and well-being. And because we were partnering with Belfast, they asked their partners down in Cork to write a perspective as well. Because for many of the learning cities across the UNESCO network, they are now very much embracing health and well-being as part of their central agenda. And because of that, and because of the links, we were delighted that UNESCO's Institute for Lifelong Learning, which manages the global network of learning cities, wrote the introduction as well. And we're very pleased that Raoul will actually be one of our speakers at our launch on Wednesday. As well as the sort of academic and practitioner chapters within the report, we very much wanted to base this in practice as well. And so we called for case studies from across all our stakeholders. And in the end, 16 case studies are now within the report, 2 per chapter. And we're anxious as well that we showed a range of perspectives on this. And although a strong base for the forum is within the community sector, we also wanted to make sure that our colleagues across other sectors were also represented. So we have Belfast Metropolitan College, for example, there. We also stretch into the private sector because Graham is a very large construction company operating in Northern Ireland. And we were reaching across as well to new colleagues, I suppose, and new relationships that we're building in the health sector. So the Belfast Health and Social Care Trust, for example, offered a couple of the case studies which are within the report. I think as well, and you probably know this, case studies are also often what the politicians will latch onto as well. So they're also important from that point of view. If you can't get a politician to read a full report, if there's a case study from within their constituency, they're likely to at least get that in their heads and recognize that maybe they should pay a little bit of attention to it. So we were as strategic as we could in getting a broad range right across Northern Ireland as well. So this slide is a quote from one of our contributors, Tony Cassidy, who wrote the piece on mental health and well-being. And I've just put it up here because in some ways this summarizes a lot of the core messages that are coming out of the report. And also, I suppose, what a lot of our expectations were when we were commissioning the pieces as well. And it's really emphasizing the fundamental link that exists between learning and health and well-being. It flags up as well a number of very core themes and benefits, such as building capital, empowerment, and resilience. And these are themes which will be found throughout the articles and are emphasized in a number of the case studies as well. And then we picked them up and used them to organize some of our thoughts when we were writing the conclusion to the report as well. And so that's what the next few slides that you'll see really focus on. And so if we come to the next one, this is all about empowerment. I've put in for these slides just quotes out of the report, little nuggets, if you were, which hopefully will entice you to read the full report as well. I love empowerment. I have to say, I come from a sort of community learning, community development background, and empowerment was always there in my initial learning, and then kind of went out of fashion, and I'm determined to bring it back into fashion, I think, again, if possible as well, because I think it's a really, really important aspect of our work. So, I mean, whether you're coming at things from a health or from a adult learning perspective, putting people at the core of both your policy and your practice is really key to everything here. And I think it's very much summed up by the final quote there as well: place vulnerable groups at the core of the agendas. And we often say this and write about it, but the practice, unfortunately, is not always as good as the talk. We need to walk the talk a lot more around this. There's, I suppose, been increasing discussion and emphasis upon co-design, for example, over recent years, but perhaps practice in Wales is better than here in Northern Ireland. But I think people are good at the talk, but not as good at the walk, really, in terms of this. And there's still a lot of resistance, and there's still a lot of feeling that, oh, that's too much effort, etc., to do. But if people are serious about addressing the issues, the health issues, the adult learning issues, and particularly reaching out to the most distant, the most disadvantaged in both those instances, then really they have to get real about making sure that people are part of the agenda and people are able to feel empowered and able to not just help formulate agendas nationally and locally, but then also get the skills around self-management, etc., in terms of both their learning and their health choices as a result. Equity and investment, sort of titling this one, or equity and resources, or we could have brought up again another not always, not contentious as such, but not everybody likes it, social justice issues. Flying certain flags here, obviously, from my own sort of perspective on work and my own approaches to it. So really there needs to be greater recognition. I'm sure I'm preaching to the converted here in many ways, but greater recognition that disadvantage is usually multifaceted, multi-layered, and that solutions that are offered are still too often coming with a single focus and with a lack of coordination between the different players and the different communities. And that's not going to work. We know it. Anybody who's been at the coalface knows that that won't work. But the message isn't fully going through to both the funders and the policymakers around this. And as it says in the sort of middle quote there as well, we have to recognize that reducing resources for one focus of intervention around disadvantage will have knock-on consequences for other aspects of the disadvantage as well. So we're saying, you know, if there are cutbacks in community learning, well, actually, that's going to have an impact upon people's health and well-being in those communities as well. And people are not making that connection. There's the lack of connection going back to government and to different range of funders as well. And this slide was throwing in 3 different themes, of course, to cover it all and to try and summarize for the purposes of this presentation. So we're talking about measurement, collaboration, and policy here. And measurement, I think, is really important when we're talking about the relationship between adult learning and health and well-being as well. Because if it isn't measured, it isn't recognized, it isn't valued. And I think what often happens with adult learning programs is that there are no evaluation questions which are asking, well, did the learners gain anything in terms of their health and well-being out of this? It doesn't occur perhaps to the funder of those particular programs that should be a learning outcome. And we're suggesting that practitioners need to push back on this and whether or not the funder is overtly asking those questions, that we actually present the evidence to them and say, okay, you are interested in employment. Here's all the outcomes that we've achieved around this. However, we have also noted that the learners achieved or recognizing that their health and well-being was positively impacted by this course as well. So we're sort of saying, don't wait necessarily for the funders to catch up. Let's present the evidence, collect evidence, present it, and educate them, if you like, in terms of making sure that this should be a central part of evaluating all adult learning. It might be a bit of a challenge, I suppose, when we're actually trying to tackle and change the practice of our inspectorates. Unless people will be telling me that in Wales, the inspectorate is already looking at these aspects, I'm not sure. But if not, why not, would be my question. I suppose the middle code around collaboration is again self-evident to most of us, and it's about breaking the silos. I think what we also have to be careful about is we talk about government working in silos as though everything is fine and dandy within our practitioner world, and we have to admit that it isn't, that we don't collaborate as much as we could, that the relationships that we have between the different sectors of adult learning provision, be they community, voluntary, or FE or Iechyd, the relationships could be better, and we certainly could make a better joined up approach that would benefit our learners much more. And again, it's about going back to the earlier slide. If we put the learners at the center, then we will build better collaboration. Then we just put our institutions or our sectors first rather than the learners. And unfortunately, at the bottom, we do have to talk about policy, of course, and acknowledge that really if there aren't appropriate policies developed, then unfortunately, a lot of the practice, a lot of the good practice which develops, and a lot of the thinking that we were talking about in earlier slides just won't actually be adopted. We need that policy driver as well, because that is where a lot of the funding will come from. And although certainly in Northern Ireland, in terms of our programme for government, we're talking much more about cross-departmental approaches and shared outcomes, etc. I feel until that is actually reflected in the budgets, which stubbornly remain siloed in terms of departments, then we won't really get the joined up practice that we need as well, because practitioners are constantly then coming up against those barriers to collaboration. So policies followed by appropriate budgets, I suppose, is what we would be talking about there as well. And this cuts across, obviously we're talking about adult learning primarily, but we're talking about it in the sense of health and well-being also. In terms of developing our relationships with those who work in the health and well-being sectors, we also need to recognize that there's a lot of work to be done there. But if the policies and the funding streams allowed it and enabled it much more, then it would be a lot easier, because usually, and I'm sure this is what you find as well, when you sit and talk to the practitioners in health and well-being, they get what we talk about. They get the need to address issues in communities of disadvantage in a multidisciplinary fashion. So there's not resistance there from the practitioners, but it needs to be enabled by the policy and funding. Well, we couldn't avoid a slide on this, and although it may not have been the original plan, obviously within the report around health and well-being and adult learning, you couldn't create a report within the 2020-2021 context without looking at COVID as well. We didn't want to make it the primary focus for the report, because there's so much that can be said on a broader basis around this as well. all of the chapters make mention of COVID and its impact, and many of the case studies as well will talk about the challenges of continuing to provide adult learning and to address issues of health and well-being within the COVID pandemic context. So obviously, I mean, there's been lots of discussion here. I'm sure there's been lots of discussion in Wales as well about how much COVID is impacting on adult learning at the moment, and also what we can learn from it. And there are many positives, and there's, for example, in the chapter on older people, there's mention of how many older people have stepped up and taken on new skills and built new confidence around IT who had never done so before. But there's also then the caveat as well. There's the caveat of digital poverty and the fact that so many who are already disadvantaged and were not engaging in learning have been further pushed to the margins by the rapid, understandable, but rapid change into online learning. And we can't continue down that path indefinitely, although it's very attractive, and you can see a lot of funders and policymakers already going, well, you could save a few bob by just putting everything online rather than all the expenses that come from face-to-face. But for many, many people, the face-to-face, and particularly those who are coming and returning to learning for the first time after many years of absence, that face-to-face is vital. And then again, if we're talking about, for example, older people, yet again, the social aspect of learning is really, really vital to address issues of loneliness and isolation. And we have to build those in. And surely COVID and the lockdown experiences have emphasized to us as well. We've all felt isolated and perhaps even lonely at times over the past year or so. And we know that Zoom, etc., which we're on at the moment, is a wonderful thing and has made a lot of connections possible, which are more difficult when we're making the emphasis on face-to-face. It is not the same as sitting down and having a cup of tea in the middle of a class and finding out more about your neighbours and building those relationships, which are such a vital part of a sort of community development approach to adult learning and health and well-being initiatives. Just going to go on. I've lost track of my time. Sorry about that, Kay. This is kind of my final slide anyway, or the final slide of any substance, and talk about what we hope to do with the report and the context in Northern Ireland in 2021. We don't have elections this year. Our election is not until 2022. You may recall we had a bit of a hiatus in terms of our government here for a period of time, and that's put us out of sync with Scotland and Wales. But there are a number of critical policies which are coming out for consultation in 2021, and this report will form part of our responses to those as well. There's a new mental health strategy coming out at the moment. We're waiting. The new skills strategy should be out for consultation this week. Later in the year, there will be our new active aging strategy will be out for consultation. And already the first part of the draft programme for government is out for consultation. And throughout all of this, we are going to use our report because it's of such significance to a number of these strategies. And B, we're going to pick up on something which is within the skills strategy, which you might be interested in. The background to that was on an OECD report that was commissioned. And one of the key recommendations from OECD was that Northern Ireland needs to build a culture of lifelong learning. And boy, are we going to make sure that that is not forgotten. It's the first time for a number of years that any policy or strategy in Northern Ireland has been so overt about lifelong learning. And so we're going to pick that up and really make it the golden thread running through all our responses to these consultations and to our ongoing advocacy work with the relevant ministers and stormont committees, etc. There isn't an all-party group around adult learning or lifelong learning. It's one of the things we're considering lobbying for, but there are other relevant all-party groups that we can gain access to around mental health, for example, around older people, around loneliness. So we're finding ways in there that will allow us to build those better relationships with government. Government's still being fairly new here as well, so the relationships are not as well grounded as we might wish for. And then I'll just finish off by, this is our succinct conclusion, I suppose, to it all, and obviously links to the final title that we used as well. Simply saying, therefore, that a healthy society will learn well, and a learning society will live well. And that's our website there. And as I say, the report will be downloadable from late Wednesday.
Brilliant. Thank you, Colin. That's really helpful, and loads in that report, and I can wish you well with launching that on, did you say Wednesday?
On Wednesday, yeah.
On Wednesday, yeah. Good luck with that. And I mean, loads of interest in there, I'm sure, for everybody on the call. And please do post in the chat. I'd just love to see your views on how we make that kind of change happen in Wales. You know, I think we kind of share so much in that report, and where we are as a nation, and kind of where we want to be in the future, that whole kind of health prevention agenda, and you know, how adult learning can sit at the heart of that. But how do we make change happen? Where Colin's highlighted, you know, we need to do more on joint projects, shared outcomes, shared budgets, shared policy arenas across health and wellbeing and across adult learning, and even more broadly than that. So there's lots to pick up on there and debate. And I guess also of interest, Colin, is the kind of whole learning city approach as well for you in Ireland and Northern Ireland, and how that's been perhaps a driver for more collaboration there as well, and probably something that will be able to harness this kind of culture of lifelong learning approach. But lots there. So please populate the chat, everybody. I'd really love to have your ideas, and maybe you're doing some great work locally, or otherwise, you know, making those kind of connections around learning and health. It would be great to hear about them. I'm going to pass over now to Llesiant, our change maker from the Future Generations Commission, and over to you, Llesiant.
Thank you very much, Kay. Pnawn da, everybody. As Kay has said, I'm a change maker with the Future Generations Commissioner for Wales, and I lead on skills for the future as a policy area in the Commissioner's office. But I feel a bit of a fraud here today, because I'm looking at some of the organisations and names in the room, and I'm by no means an expert on skills and education. But as there's so many experts in the room, I'm going to shamelessly take this opportunity to outline some of the Future Generation Commissioner's work to date on skills, and hopefully stimulate some discussion or some thought, I suppose, on the role of adult learning and the interconnections, exactly as Colin's just been talking about, really, between policy areas, and the huge opportunity we have here as well. So I'm also going to try and share my screen now, and I hope that's going to be loading up there for you.
Yes, thanks.
Great, thanks, Kay. So yes, skills for the future. Well, let me tell you a little bit first about the Wellbeing of Future Generations Act and about our work. Now, hopefully lots of you will already know about the Act and know about the role of Sophie Howe, the first Future Generations Commissioner. That's Sophie on the top right-hand side of the screen there. But it is Monday and you've had a lot of information to take in, so indulge me while I tell you just a little bit about our work, and perhaps for Colin's benefit as well, visiting us from Northern Ireland. So the Wellbeing of Future Generations Act was enacted in 2015. You can see on the left-hand side of the screen there, the United Nations Sustainable Development Goals, and really they were our inspiration here in Wales to set legislation in place, which is the first of its kind in the world, I did catch up with some of Kevin's speech earlier this morning from New Zealand, and New Zealand, of course, are doing some fantastic things around wellbeing economics. Iceland as well, Canada, there's lots of organisations who are really interested in this agenda and also really interested in our work in Wales, because we were world leading. You can see the quote at the bottom of the screen there from Nikhil Seth, that he said, "We hope what Wales will do today, the world will do tomorrow," when we were introducing this piece of legislation. So it's really, you can probably tell from my excitement, I'm very proud to work on this. The National Wellbeing Goals, which you can see in the centre of the screen, are based on the United Nations Sustainable Development Goals, and they were imagined by the people of Wales after a national conversation. At the centre of the legislation is a jargony term, the Sustainable Development Principle, which essentially means it places a duty on many of the public sector organisations in Wales, so every local authority, Welsh Government themselves, for example, health boards, national park authorities, to act in a manner which seeks to ensure that future generations are able to meet their needs as well as current generations. So as you can see, the architecture here of the Act, it covers 44 bodies, as I've started to describe. And the Sustainable Development Principle is made up of 5 ways of working, which are at the centre of the screen there. And I was listening to Colin's talk just a second ago and thinking how much of a read across there is, because this is about, you know, wider well-being, it's about population well-being, and lots of that is predicated on integration of budgets, of policy areas, involvement of people, that term empowerment. So there's a lot of commonality here and a lot of opportunity, I think, to use this legislation as, you know, an overarching framework to hang your policy on, really, from whatever perspective you come from. Sophie, the Future Generations Commissioner, she was appointed in 2016, and she has a 7-year term. The Commissioner's role in the Act is defined as acting as the guardian of future generations to meet their needs. So it makes her sound a little bit like a superhero. And we have a small team that help her to do that. And I'll come on to some of our sort of areas of focus in a second. So what some of you may not know about the Act, even if you have heard about it, is that we're under a statutory duty as the Commissioner's team to publish a Future Generations report every 5 years. So the first report was published in 2020. What a year, hey, to have to publish a big policy document. And this is the interactive website that you can visit to find out more about it. The kind of cartoony image you see is our image of a future Wales. So as you explore it, you can see sort of technology, renewable energy, culture, Welsh language that really represents the Act, green infrastructure, nature, equality. So I'd encourage you just to go and have a little look at it. The report itself is sizable and full of case studies, like Colin said, always a good way of getting people interested, particularly politicians, shall I say, in the work. It's full of case studies, it's full of evidence, international evidence, not just here in Wales. And I'll be talking you through some of the kind of recommendations and evidence and the work that we've done since, really, based on the bedrock of what was the report. So the report covers several areas of focus, as I say, and one of them is skills for the future. So this slide is a bit word heavy, I know, but it's taken directly from the chapter on skills for the future in the Future Generations report, if you wanted to go and have a little look at that afterwards. So the report's aim is to provide an overview of where the Commissioner thinks the 44 bodies I talked about earlier under the Act are in terms of implementing the Act. Like, where have we got to in the 5 years that we've had the Wellbeing of Future Generations Act? And the report is also statutory in terms of the recommendations it makes to Welsh Government and the other public bodies. And although they don't have to follow the recommendations to other organisations in Wales within this structure as well. within our sort of public and civic society and voluntary sector. So in terms of, you know, the recommendations, they can be quite powerful, really. And what we've done in the report is try to show, like, this is why we need to change. Lots of our role is to think long term, to see the integration that perhaps other people don't, to highlight big challenges and opportunities and build a movement for change. That's what we see our position as an independent commissioner. So some of the things on this slide have changed and moved on even since May 2020 when the report was published. And positively, as you'll see, some of the recommendations have already been adopted by Welsh Government. But you can see some of the key stats and trends here that the report draws on. We know that, you know, automation and technological change is coming our way. We know that we've got an ageing population here in Wales. We know that we've got a large SME sector, for example. And of course, just like Colin said, I couldn't go without talking about the impact of the COVID-19 pandemic. And some of it's brought positive benefits to how we work and live, of course. And it comes at a time when there's great opportunity in Wales. We've got a new curriculum being rolled out, for example. The children learning the curriculum from 2022 are the adult learners of tomorrow and our workforce of tomorrow. And generally, there's this trend that, of course, career pathways are becoming less and less defined. So lifelong learning is becoming even more important. And I know you've been hearing about the new Commission for Tertiary Education and Research this morning. And that's a massive opportunity to place, you know, well-being in its broadest sense, as it has done in the curriculum for under 16s, at the centre of our policy. In putting together the report, we spoke to a huge range of people. We called the conversation Our Future Wales, and we spoke with, you know, businesses, public sector organisations, children and young people, all sorts of different people. And we brought together, you know, the evidence, case studies and integration to create this vision for, well, each of the areas of focus in the report, but Skills for the Future is the one we're talking about today. And you'll see that the tagline is equipping people not just for work, but for a life well lived, extremely similar to what Colin just left us with in his presentation and what you've, I'm sure, discussed today. So we're looking to the long term, future generations, of course, and looking to 2050 about the kind of Wales we'd want to see. I don't think we can disagree with the way we value, assess and resource skills programmes will have changed. But, you know, as the great saying goes, we're in control of our own destiny and our own future here in Wales. And we've got this amazing act to help people to think more about how we get to that vision and that future. Now, the next slide shows the 7 national wellbeing goals, and I haven't covered everything in this slide, but I was just trying to give you an idea of why Skills for the Future is one of the Commissioner's areas of focus. She's picked a small number of areas of focus through, again, a national conversation she held back in 2017 when she was newly appointed. And Skills for the Future is one of them, because we truly believe that if you get skills right, then clearly you're going to have a lot of impact across the 7 national wellbeing goals and help us all to get closer to that Wales that we want to see for our children, our grandchildren, and generations beyond that. For the purposes of this workshop, of course, when you look at how you can contribute to a healthier Wales as defined under the Act, Skills has huge far-reaching benefits for that. A prosperous Wales, for example, prosperity in the Act is not defined just as gross domestic product or wealth. It's a low carbon innovative society. Its definition is in law. And you can see there that we've looked at how low carbon industries, for example, a growing green economy, renewable energy, green technologies can give people the right skills to prosper in a future Wales. Equality, clearly at the forefront of lots of our minds at the moment. We want to see an approach to skills that reduces inequalities, narrowing inequalities for women, people of Black and ethnic minority groups, disabled people, others who are furthest from the labour market. So much of the report was written pre-pandemic, but arguably the trends, issues and recommendations within it are even more relevant now. What opportunities do we have? to reimagine the future of adult learning, employment, our lives. How can we prosper whilst having a positive impact on the environment and on equality? And since the 2020 report, we've been trying to advise, connect, guide government and other players on these sorts of questions, from how Welsh Government are setting their draft budget in an integrated way that seeks to, recover in a prosperous, green and equal way, but, maximise contribution to as many of those 7 goals as possible. And to, nature restoration projects and the Green Recovery Task Force set up under Leslie Griffiths. We've been working with them too. What I can say is that, much of it comes back to having the right education, training, retraining, and therefore a skilled population in place. A green and just recovery wouldn't be so if we didn't have those things there. And I rather like this cartoon because, of course, it shows that before COVID-19 came along, we did have quite big problems to deal with that perhaps governments don't pay as much attention to sometimes as they should. We've been doing some really interesting work. The reason that the New Economics Foundation and Wales TUC logos are at the top of this screen is because my focus has been on really looking at what the current picture is in terms of skills and apprenticeships and traineeships and adult education, as opposed to some of the fantastic opportunities that we might have if we really do invest for a green and just recovery. So there'll be more, I'm sure, coming out from the Commissioner's office on that very soon. So a quick flavour then, because I'm short of time, of our recommendations and the avenues the Commissioner has been pursuing recently. As well as the Future Generations report, we published a manifesto for the future in October 2020, which has clear recommendations building on the 2020 Future Generations report. And the purpose of the manifesto for the future is to get some key asks, I suppose, in the front of the new government's minds. So the key recommendation from the 2020 report is in green at the top there, to bring all sectors together as part of a coordinated national mission to deliver education fit for the future. Of course, there are policy things that flow out of that, and some of the other key recommendations are on the screen there. So given the slide I've just shown, you won't be surprised to see we've called for improved alignment and action towards the climate and nature emergencies, and investment in skills, training and industries that provide a green and just recovery. Of interest to maybe you in the room, establishing a national vision for lifelong learning. Establishing a national vision for Wales to become the most eco-literate and globally responsible nation in the world. Pilot a basic income to allow people to go back to education should they need to. Explore opportunities for a shorter working week to allow people to learn outside of work potentially. Obviously, there's many more in the report and in the manifesto, and I'd encourage you to have a look at that. But there's obviously process recommendations in the report as well to make some of those things happen. So for example, I flagged the key recommendation around raising possibly an education tax. So we've made the recommendations that government could use their new taxation powers and the existing economic contract which they have with businesses to incentivise them to work more with schools and with education providers within their area. There's also recommendations in there around the new Commission for Tertiary Education and Research, which I mentioned earlier. And also around a reformed role for regional skills partnerships and how we can help them to think more about the future, the long-term skills needs for their areas. But these are really just a small flavour of some of the recommendations we've made to government. And we know that Welsh Government are actively considering and working their way through them at the moment. And then there are recommendations within the report at some of the other sectors, that some of them who are covered by the Act or some of them who are optionally choosing to take the Act on board and contribute to the 7 national goals. We all need to work in a more coherent way, of course, towards the shared vision of the national wellbeing framework we have here. So some of them about are about skills and training having a positive impact on the environment, skills and training having a positive impact on our Welsh language and culture, and on equality. So that was really all I have time to talk you through today, and I apologise that it's been a whistle-stop tour. My last slide gives some small pictures there of some of the other resources that we use to put together the Future Generations report and the manifesto for the future. Many of you have probably been involved in some of those reports, and I'm sure you've seen them before. But now that you've seen me, met me virtually, hopefully you know who I am now, and you'll be connecting with the Commissioner's team in the future around some of these asks and recommendations. Diolch yn fawr am wrando. Thank you very much for your time.
Diolch, Helydd. Gosh, there's lots to go on there. We could spend the rest of the afternoon, I think, picking up lots of the points for discussion with you and Colin. And I will just pause there, actually, whether anybody kind of here with us this afternoon wants to come in and ask a question. If you do, please just unmute yourself and join the conversation. But lots of interesting stuff there. I mean, an education tax, integration of budgets, and I love the phrase, you know, a life well lived, because, you know, we've heard this morning that mix around what is adult education, what adult learning for, and yes, it's for jobs and the economy and future growth, but it's also about giving people and communities chances of better life and better prospects and living well. So I think that's all really important. And I just wondered, Helydd, if you wanted to make a comment. We heard from New Zealand this morning about the focus on well-being in New Zealand and the kind of strides that they're taking there. And that's kind of materialised into a well-being budget, which has then had a kind of knock-on effect for more investment in adult learning there. Any thoughts on that?
Oh, definitely. We've worked closely with colleagues in New Zealand, because there are some camps, of course, really interested in having a Wellbeing of Future Generations Act there in legislation, and as I mentioned, other countries too. So even more easier now without a carbon footprint, that we get to speak to quite a lot of countries about the approach. In terms of the wellbeing budget, we've made recommendations in the Future Generations report that Welsh Government adopt a similar framework for their budgeting and economics, particularly because we have this legislation in place. So I suppose watch this space, Kay. I think they are making steps towards it. The most recent draft budget certainly shows some elements of that, but I think there is still probably some way to go here in Wales, just because the ways, it takes a long time, I think, to change some of the ways that we've always done things. I'm sure that's been another theme today, hasn't it?
It is, yeah, it is, it does. But we're a small country, aren't we? And I think, you know, if we've got that opportunity, haven't we, to kind of take a lead as we have with your work and make it happen. There is a question in the chat, and it's, would you agree that we need a coordinated approach to encourage employers more to look at the benefits of upskilling their employees?
I think yes, is the short answer. I know we're short on time. Yes, definitely. I don't know whose role necessarily that might be. There are more experts in the room probably than me on that, but the new commission, I think, has got a huge remit already, but quite an exciting opportunity to look at that connection between learning institutions and employers. And you've got a really, you know, I don't know how many people are on the call who are from business. We've got a really keen business sector in Wales now as well, who are very interested in the principles of the Wellbeing of Future Generations Act and showing that they don't just stand for economic benefit. They are, you know, really excited in having social value locally as well. So, as you say, Wales is a small country, and where we're close people with strong culture, I'd say. So there's definitely opportunities there to have a coordination around this.
Great, thank you, Helydd. So we'll move along to Glyn now. Welcome, Glyn. And just picking up on that kind of theme of a life well lived, we first met when we visited Bromley by Bow Centre in Tower Hamlets in East London, which is an incredible initiative. For those of you who haven't been there, I'd recommend a visit or a dip into their website, but they've really kind of cracked it in terms of having that kind of holistic approach to learning, skills, community and health. So really pleased to have met Glyn there a few years ago now, Glyn, I think. But also to say that you went, you visited, you looked at what they were doing there, and then you kind of came back and you're working on translating all that you learnt at Bromley by Bow, but obviously with the work that you do with Betsy Cadwallader Health Board and making those partnerships work in the north of Wales. So I'll hand across to you, and thank you, Glyn.
Thank you. And Wendy's going to kindly operate my slide, so I'm hoping we'll be in tandem and slick with this. I don't think I've probably ever been teed up so well as I have been by Colin and Helen today, because hopefully everything I have to say will resonate with the themes that they were drawing out. And I'd like to suggest some of the more practical examples of how we're taking it forward. So Well North Wales was a programme that Betsy Cadwallader Health Board decided to invest in probably about 5 years ago now. And I think it's probably about 3 years ago that Kay asked me to present at an event as well. And that time, a lot of it was around the concepts and the intent. So it's actually quite nice today to report back on how we managed to turn some of that intent into action. So as this slide says, Well North Wales is a framework for local communities, organisations to work together to improve health and wellbeing and reduce inequalities. So my role is very much focused on that health and equality agenda. And the penny's slowly dropping, I think, with some of my colleagues in the NHS, that the vast majority of answers to this are to be found outside traditional health service. We don't have the answers. We deal with the consequences of not addressing health inequalities. So if you're happy to move on, Wendy, thank you. And this is probably my favourite slide, one I use all the time, because the gradient will only improve if we address those factors beneath it. So the work of the NHS is going to get increasingly more difficult the more we have to push whatever it is up that steep hill. And if you look halfway down the list, you will see the limited opportunities for education listed as one of those sort of key determinants. And in going through that list, you will find that very few of them relate to the core business of the NHS. So most of my work and my day-to-day work, I would say that probably 90% of it is to do with working with people across North Wales on a number of those agendas and asking the question, what can we bring that's additional to it? I mean, very mindful that it's not about stepping on toes, it's not about taking over, it's about adding value. Thanks, Wendy. So the 4-component part or 5-component part of Well North Wales, at the core of it is a networking function. People tend to be constrained by their organisational boundaries or their geographical boundaries. And because I have a regional remit, it's useful sometimes to put people in touch with each other. The focus has been on housing and homelessness. It's on developing the physical infrastructure around health and wellbeing centres. Social prescribing. I was interesting earlier when Colin mentioned Spring in Northern Ireland. Before COVID, I was talking just to Spring and others about having a coming together of the Celtic nations to compare and contrast our social prescribing work. And then what I've used as evidence today, some of the programmes will be in and around food poverty and how that's been taken forward and the link there with skills and education. Okay, there you go. So, quick definition, food poverty is the inability to afford or have access to food to make up a healthy diet. And it's about the quality of food as well as quantity. And I think that's useful. Okay, Wendy? And just some quick figures around this then. That most people who live in poverty in Wales live in households where at least one adult is in work. And again, that resonates across a whole range of subject areas. That 20% of people in Wales have been worried about running out of food. In the past 12 months, 14% of people in Wales had actually run out of food before they could afford to buy any more. And fast forward, there's likely to have been an increase in these figures because of COVID, and we're going to see that, I think, for a number of years to come. So the first one I was going to reference was Gweithdai, which has been a few years in the pipeline. We now have about 10 organisations signed up to supporting the venture, and last year we set up a community interest company. So it's about the provision of food. So it is about fair share and surplus stock from supermarkets. And we've got a launch date of the 1st of March, which is only next week. We've got lots of work to do. So we've been doing some work in terms of food distribution towards the tail end of 2020. But the actual go live for this project is next week, where we will take that surplus stock, distribute it to the communities, basically based on a membership scheme. So people will pay £5 a week, but they get at least £20 worth of food back. And the focus of that will be, hopefully about 50% of it will be on fresh produce. Understanding that food banks can only go so far, and most food banks don't provide any fresh produce. So what we're trying to do in addition, I suppose, are the other two elements to this, is about enhancing the skills. So Llesiant on the call today has been instrumental from a colleague menai perspective in terms of introducing a community education programme. So not only are we distributing the food, but there's the understanding that for a number of people now, receiving a bag of fresh produce is quite a challenge. So having that community education programme will hopefully help. My colleagues in dietetics and the health board do the Come and Cook programme. I'm hoping to create recipes as well, whereby the people who pick up the ingredients, if they're feeling that they've gone through that educational programme, that they're supported, they're more able and willing to cook for themselves. And then finally, it's about the provisions of things like slow cookers. We're talking now about blenders and microwaves and other things that people have the utensils, the skills, as well as just the provision, because it's based on the understanding that just the provision alone is not sufficient. Okay, and again, if you, without naming anyone on the call today, I think they've developed quite a few muscles in stacking these shelves for us. So you can see there's some fresh produce there, a number of tin stuff. We have, I think it's 5 industrial fridges and 5 industrial freezers at the back. So when people make their choices, they will have that choice of what they wish to have for their £5 a week. And the more we can ally that to the community education programme and the skills development, obviously people become more confident in terms of what they're doing. So even though this is sold as a food waste initiative, it's actually a destigmatised or non-stigma food poverty programme as well. Thanks, Wendy. Linked to the work in Anglesey is a new programme that's in development just over the bridge in Bangor. So it's about building on what we've done in Llangefni, but looking at the elements of food poverty, food waste, food production. I mentioned that, in terms of my role, I'm sort of ultra sensitive. It's not about stepping on people's toes. It's not about taking over. It's about trying to harness what's already there. And if there's a need to forge a local partnership, to be the enabler for that to happen. So you've seen the food poverty side of it, for instance, that it's working with the Cathedral Food Bank. My Sneeze, a major initiative on the Maesgerchen housing estate in Bangor, where just in the overlap between food production and food poverty there. Penning House, which is a drug and alcohol rehab centre, I think they hand out about between 80 and 90 food boxes a week based on lots of their fresh produce to that estate. So there's a number of existing initiatives. So it's about trying to bring those together. And what does that initiative look like? So move on to the next slide. So similarly to the Anglesey one, the additional one here, I think, is in terms of the production. So where all things sort of start off for this diagram. So basically, I mentioned Penrhyn House already. As part of the recovery programme they're growing an awful lot of fresh produce. They're hoping to double their production in the next couple of months. I'll also be working with Wellbeing, which is a medium secure unit for North Wales. So people who are getting close to coming back into the community will have an opportunity to participate in growing produce there. Bryn is an old mansion estate. The mansion house itself has gone, but the wall garden is still there. So our efforts now is to bring the wall garden back into use, which will give us over an acre of land to produce foodstuffs. We'll have the Llangefni equivalent in terms of the food share, but we also want to set up a training cafe. So for those who are coming through drug and alcohol recovery, those who are in the homeless hostels in Bangor, and those are then identified by our community mental health services, have an opportunity to work in the training cafe. The bulk of the produce will be produced either through Penrhyn House or Bryn initiative. Colleague men again have offered to come in with NVQ training and apprenticeships. And we're hopeful that we can have a prime site in the city centre to get this initiative up and running in the very near future. The way things are with Welsh Government funding, they've set me an unenviable target of spending all the money by the end of March, which I'm determined to do. And we can do that, we will get this scheme set up. So this will be both the food waste initiative for the general community and the training cafe concept, whereby people who are most vulnerable, those coming out of drug and alcohol rehab, as I said, those who are in the homeless hostels, those with mental health issues, will be supported back into employment through a skills-based programme focused on food, which comes back to the reason and rationale for this session we call Food Enabler. It just happens to be the one thing that I found in my sort of four or 5 years in this role gets people down the table, gets people engaged, and enables us to take that wider health and equality agenda forward. Thanks, Willie. And then the final example from Plasmadoc, which is on the outskirts of Wrexham. Plasmadoc is a huge housing estate. Apparently, if you look at it, it seems to be built in a field with few other assets, apart from the major one being, you can see there, the Plasmadoc Leisure Centre. So the community took that leisure centre over a few years ago, and that's been the sort of the hub really from where we were trying to generate the support and get this programme up and running. So what we have there, an organisation called Wellfed, which is a collaboration between Flintshire County Council, Oedolion Housing Association, and an organisation called Can Cook. They're going to be producing packs of food for the community linked to a slow cooker programme and the community education programme alongside that. In the last autumn, back a bit, sorry Wendy, one last one. On the right hand side there, you'll see some examples of what we did for a staff health initiative within BCU. So we produced the book of recipes with a 6-week programme of offering meals at cost, which is about 60 pence a portion, and encouraging our own staff, a number of whom are low paid, and a number of whom have to access food banks to try and build up their skills base, and then taking that skills-based knowledge into the community in Plasmadoc to do the same there. So we ran that programme in October, November. We're now going to try and introduce the work with Wellfed. Really difficult because obviously Leisure Centre can't open normally as it would because of COVID. Engagement with the community is more difficult because of COVID, but people are persevering, and I think we are getting there. Sorry, Wendy, and now the last slide, last but one slide. So in conclusion to all this, I've alluded to the fact, food allows other things to happen. Food brings people into this partnership arena. I suspect that post-COVID requirements will be greater than ever, and we will see the social and economic consequences of this for many years. But the whole food thing is not about creating dependency. It's about trying to promote independence and security for individuals, for families, for communities. And ultimately, the skills and training are essential components of that. And I think I'd probably finish with the most cheesy slide of the day. But I don't think it's ever been truer that just giving people the food is insufficient. We have to build their confidence, their skills, their ability to do something with it. And that's a quick run through some of the food poverty issues in the Well North Wales. Diolch.
Llyn. That was a great run through your kind of busy agenda up there, and well done on the tenacity for kind of keeping it going through the last year, definitely. And I mean, something that struck me really is in terms of what you're doing there is giving people the kind of skills to find their own solutions and to contribute to the kind of you know, better lives and better solutions for themselves. So some really good work there. I don't know if you've got any questions for Glyn. I know we're kind of coming beyond the time of the session, but flag them up now if you do. But a question from me, Glyn, really, if anybody's sitting on in this workshop with us today, you know, wants to go and make some contact with their local health board, has got some great ideas, want to collaborate, what any advice for the kind of best route in to do that?
I sit under the Director of Public Health, so that's probably the best route in. This is your core public health agenda. You know, health inequality should feature in public health work of every health board in Wales. So I think that's probably the best route in. Yeah,
great, thank you. And I think on the chat earlier, I posted kind of at the top of that chat a link to Marmot, and I think in February last year, Marmot issued an update to his report, kind of 10 years on. His report was all about health inequalities, Michael Marmot, and essentially, I mean, he's a physician, but the whole focus of his research when he's looked at health inequalities and where the issues are, as Glyn said at the top of his slide, you know, it's linked to poverty, low levels of education, lack of employment or lack of good work, housing, and I think climate change is in there. So learning and education is really part of the solution to all of this and this preventative approach to health issues that we have. So we can all play a part in this. So thank you ever so much for that. And there's a couple of questions coming in, which I'll just go through now. Yeah, somebody's asking, Glyn, I don't know whether you know, but is there a similar programme to Well North Wales in Swansea Bay? So we need a Well Swansea Bay initiative, I think.
I'm not aware of one. I think Well North Wales was set up because the Director of Public Health at the time really wanted the health board to address the health inequalities agenda as a sort of almost like a standalone project, a very visible project. What you tend to have, I think, in lots of other areas, it's woven into existing programmes rather than having its own profile. Yeah. So I'm not aware there's any other health board in Wales with anything similar.
Okay, and Helen, you've replied to say you recommend engaging with Public Services Board for your area. Public Health Wales also sit on these and they have a wellbeing agenda at their core. Do you want to say something else about that, Helen?
No, not really. If people aren't aware, public services boards are the collection of the leaders of the key public bodies and voluntary sector organisations and business and education leaders sometimes. And there's 19 across Wales that they're based on the local authority footprints. But for example, in Gwynedd and Ynys Môn, they've joined forces. So there's one across that area, and they are sometimes quite difficult to get hold of, hence me putting a link in the chat, and you can also find out more about them on the Welsh Government website, and we can put you in touch with your public service board support team for your area as well if you are interested, because often they've set objectives around well-being, around learning, around some of the you know, difficult challenges that Glyn was talking about, so worth linking in with them too, however you can find to do that.
Thank you, Helen.
I'd also say, you've got the Public Service Board, you also have the Regional Partnership Boards, and a lot of Welsh Government funding tends to flow into the Regional Partnership Boards. So even though they're, I suppose, not quite as far upstream as Public Service Boards,
I think I've lost my connection. Can anybody hear me?
Here, UK, I think Glyn's
Have we lost
frozen.
Glyn?
Yeah, I think Glyn's connection is frozen.
Okay, well, if we'll try and capture what he was going to say after this session and kind of share that again. But can I just thank everyone who's contributed today? It's been really helpful for me, actually. And I hope those of you on the in the virtual room with us today have enjoyed this session, and we've got lots to think of, lots to do, and I think lots of change to still make happen. So thank you all, and thanks for joining us, and wish you well and hope to see you again soon. Take care.